अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे MCQs ऑफ अपर एक्सट्रीमिटी इंजरीज। A 42-year-old man comes to your office with complaints of right shoulder pain. He does not remember any specific injury, but he has been playing a lot of tennis over the past 4 months. He tells you that opposing players no longer fear my serve. It has been difficult and painful for him to reach overhead, and behind him, rolling onto his shoulder in bed is painful. On examination of the right shoulder, there is full range of motion in all planes, with obvious discomfort at end ranges of flexion, abduction, and internal rotation. There is significant pain when you place the shoulder in a position of 90-degree flexion and then internally rotate. There is mild weakness with abduction and external rotation of shoulder. The rest of the musculoskeletal examination is normal. MCQ 1. Which of the following is most likely diagnosis is impingement syndrome? Which of the following is the best initial treatment? Strengthening and range of motion exercises. Predisposing factors for this problem include which of the following? Repetitive motion of the shoulder, hooked acromion, acromioclavicular spurring, shoulder instability. Answer is E, all of above. Problem 2. A 37-year-old man with right elbow pain come to the office. He has been painting the walls of the kitchen for the past 5 days. He tells you that the colors came out beautiful, and his wife is very happy, but he is really paying the price. He has pain with lifting, shaking hand, and elbow extension. On examination, he has full range of elbow, but pain when the elbow is fully extended. There is also pain and weakness with wrist extension and supination against resistance. Palpation reveals tenderness over the dorsum of the forearm extending proximally to the elbow. The rest of musculoskeletal examination is normal. Which of the following is most likely diagnosis is olecranon bursitis? What is the primary muscle involved in this condition is extensor carpi radialis brevis. Which of the following is initial treatment? Best initial treatment is rest and progressive stretching and strengthening program. Problem 3. A 29-year-old woman with severe rest pain came to the emergency. She has pain for a few months, but during the past month it has worsened significantly. She denies any trauma and other than having a cesarean section 4 months ago. Her past medical history, surgical history are unremarkable. On examination, there is tenderness just distal to the radial styloid. There is full range of motion of the wrist. Which of the following is most likely diagnosis is E. What is the best initial treatment is thumb spica splint. Problem 4. A 23-year-old woman injured her hand while scaling one day ago. She caught an edge and fell onto her right ski board. She notices swelling at the base of her thumb and has pain when she moves or bangs the thumb. On examination, there is tenderness over the medial aspect of the first metacarpophalangeal joint. When you stress test the ulnar collateral ligament, you note laxity compared with the opposite hand, but there is a firm endpoint. There is no tenderness to palpation of anatomic snuff box. 9. Which of the following is most likely diagnosis is grade 2 sprain of ulnar collateral ligament? What is the initial treatment? Initial treatment is cast immobilization. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे. थैंक यू सो मच.